Generally, there are 4 different kinds of doctors in this world. Number 1, the honest, open-minded healthcare professional doctor that combines competency with state-of-the-art knowledge and technology and machines, methods, latest science know-how, and so on. Number 2, the doctor that's open and honest, but who uses old, misleading concepts, misguided concept, is stuck in, let's say, old traditional thinking that didn't really take into consideration latest science developments, latest gadgets, technologies, use cases, and so on. Number 3, the dishonest, unopened guy who will do anything possible in his power except to help you. He will only help you if it's in his own profit-driven greediness for his own pocket. So this number 3 is basically purely driven from an own profits perspective to maximize his wealth, his pocket, his money. And whether he can help you or not, it's totally dependent on the underlying fact if this improvement of condition can only be achieved under his profit maximizing function. And the last one, number 4, are the doctors that are completely controlled and driven, not only to some extent, but totally by the pharma and lobbying organizations, who will do anything that the pharma and lobbyists will tell them to do, and this will lead into a pharma-driven concept of treatment, medicines, diagnosis, and so on and so forth. Now guess what are 99.9% of all doctors out there? Which groups are they on? You're right, number groups 2 until 4. So number 2, 3, and 4 are, let's say, the vast majority of our doctors that we are facing today, at least considering any services or any professional services when working in the public health system. Of course, this also is relevant for the private sector, but less on the private sector, because if you're visiting a doctor with your own money straight instead of being compensated by the insurance companies, then of course the incentives are already straightforward. So let me phrase it differently. Our world today in the public health system is totally controlled and paid, driven by the pharma lobbyists